What an amazing story, Sarah. Thank you for sharing. Hello, everyone. I am Alicia Lawrence, the Patient Services Case Manager here at NORD. Working with patients services, I see firsthand the struggles and importance of building great care team for patients and families affected by rare diseases. Today, we have three experts with us who, who will share how to identify the team of healthcare providers and ways to evoke communications amongst them. Joining us on this panel is David Flannery, Dr. David Flannery, Director of Telegenetics, Digital Genetics at the Cleveland Clinic. Ashley Santana, Complex Care Social Work Care Manager at Cincinnati's Children's Hospital Medical Center. And Jim Kahn, a patient and advocate at the Foundation for Sarcoidosis Research. I want to thank our speakers for being with us today to share their expertise. And now, Jim, I will turn it over to you.
I apologize to my teammates. I will join you in my chair shortly, but we had a 4.5-hour drive yesterday, and as many of you may relate, I'm a fellow rare disease patient, and my body did not react very well to the drive, and I woke up this morning with both my feet numb and my left leg numb, and now I have just a little bit of brain fog, so just bear with me a little bit, and I'll sit down in my chair with my fellow presenters for the Q&A, but I'll have to wing it for a little bit at the podium and sit down. So thanks to the organization for allowing us to be here today, especially me as a patient, to be able to provide a patient perspective. Often our voices get drowned out a bit with all the medical noise. No offense to the doctors and clinicians that are with us today, because those voices are certainly important to us, but sometimes we just don't get heard. So thank you to NORD for the pointed focus of the forum today. Before I jump into my tips for building an effective care team, I want to just share some general tips about what makes a great care team. So, what does make a great care team? Well, first, you got to communicate, and communicate some more. You have to have clear lines of communication. You have to have multiple channels of communication. You can't just talk to your care team when you're in the office. You can't just use a telephone. You can't just use your electronic charts. You can't just use a fax machine. Honestly, I have one of my care providers that just says, "Can't you just fax it to me?" So I've had us download an app that allows me to scan something to this fax app and fax it to her. But sometimes you have to go through those hoops to accommodate your care team partners. So you have to have all these multiple channels to be able to communicate with all your health team partners. You have to have all your team members communicate as equals. So you are on an equal basis with your all your health team partners, and they're all equals. It's important that all your doctors consider each other as equals. No one is higher or lower than another. And you should encourage diversity of opinions with your team members, because that encourages creative thought, and they may come up with unique treatment options for you. The next one kind of goes along with that, communicating as equals, and there should be mutual respect and appreciation and trust among the team. That goes above and below within the team. And I will say, on the appreciation part, I'll ask you as patients, when's the last time that you brought in flowers or cookies or candy to your doctor or to your front office team or your medical assistants? I'll tell you it goes a long way, especially when you call in at the last minute and say, hey, I need this form really quick. Can I pick it up 5 minutes before the office closes? Try it, and they'll remember you. And then the trust factor. You have to build a level of trust with your care partners, and they have to trust you, because when you come in and say, you know, this hurts when I do this, they have to trust you that it does. And on the same point, positive attitudes always. This goes both ways, but cranky never works. Don't be that patient, and don't be that doctor. It goes both ways. You have to have clearly defined roles and responsibilities. Everybody has to know who is doing what within the team, who's responsible. You have to set expectations and accountabilities for the team. So everybody has a specific role on the team. We're going to cover that in a little bit. And you have to have specific defined and agreed upon roles and responsibilities and goals. And these should be written goals, frankly. The number one goal of your healthcare team is to deliver high-quality patient care. You are number one. You're the number one goal of your team when, above all else, because you can get lost in the crowd, but the number one goal is to provide high-quality patient care. And then there should be measurable outcomes for your team. What's going to happen in 3 months? What's going to happen in 6 months? What's going to happen in 1 year? Will you have a treatment plan? What's your growth of your treatment? What's your, do you expect to have, will you be cured? Will you have growth? Will you have whatever is in your treatment? All right, so those are the things that make a great team. What I do with my drink? Oh, thank you, Ashley. I think I'm going to have to hold it for a while. One of my rare diseases gives me dry eye and dry mouth, so. All right. So I've got 3 tips for you for what I've learned along the way in my now 12 years of having multiple rare diseases and 6 other autoimmune disorders. So the first one, and now I'm going to have to put you to work. You have to be your own advocate. And this may be hard for you to believe, but nobody's looking out for you except you. And nobody is as qualified as you. Nobody can do it as good as you. Nobody is as motivated as you. Frankly, you have to fight for what you need. You have to fight for the right medicine. You have to fight for the right doctors. You have to fight for the right treatment. You have to fight for the right information. And then here comes the other ones that everybody knows. You have to fight the insurance companies. You have to fight the billing offices. You have to fight. You have to fight for what's right. And honestly, that's what you have to do. And I know this is hard. It's hard when you don't feel good, but it's what you have to do. And it's something that you have to do well. It's something only you can do. And you'll find that you will become an expert in so many disciplines because you have to. Over time, you'll be able to pick up competencies in certain areas. You're not going to become an expert in everything, but over time, you'll surprise yourself at how well you become. When you call a specialist and they say, yeah, certainly, we can get you in. I think 9 months from now, we have an opening. Well, you say, no, that's not going to work. I have to get in now. And can you check again? And they'll say, oh, yeah, I think we can get you in next Tuesday. And you just keep pushing because you know what you need and you know what's right. So I'll mention it in each of my tips, but today is a good start for you. You're going to learn skills and abilities and information here, and that's what you need to do. Take every opportunity to learn how to improve yourself and become a better advocate. Number 2. I'm going to make you work some more. Not only do you have to be an advocate, you have to be a coach. You have to build your own healthcare team. Nobody else is going to do it for you. Don't get overwhelmed about building the team. You don't have to build it all at once. You don't have to build the perfect team on day one. This is an evolution that happens over time. I'm still building my team 12 years in, actually 10 years, because I didn't know I had to build the team for the first 2 years. It just took some time. So I'm still evolving. Honestly, 2 months ago, I lost my expert in my main one. So I had to start doing that. How you do it is you get an anchor, you get an all-star, somebody you can rely on, and you build from there. Somebody you can trust that builds a baseline. Then you ask for referrals and recommendations from there, and then you ask them for recommendations, and you just keep building. It is okay to swap players on your team if they're not experts and not meeting your skills and requirements, and they're not meeting your expectations, like we said on the good care team. You can swap them out, and it's okay to fire members of your care team. Doctors can fire you too. Honestly, I had a pulmonologist who told me my reason for my shortness of breath initially was because I was fat. Now, you can look at me, and that was true. But a month later, another doctor did a CAT scan, and I had masses in my chest and lesions in my lungs, and they had been there for years. And so that was an ex-pulmonologist, by the way. So another biggie is to research, learn, and share that information. Research all you can. I love webinars. Join whatever foundation or associations, whatever you can. Again, today is a great opportunity. Then get involved. Get involved wherever you can. I love being with NORD. I'm involved with NORD's state operation, and then share that information. There's going to be a lot of opportunities today along the way. Last one, and Sarah mentioned this, and it is true. You're not alone. I could have told you dozens of other tips, but I feel very strongly about this one. Your journey with a rare disease, it's a hard one. I woke up this morning saying, man, this is awful. I feel awful. I knew I would. The 4-hour journey coming up here, I mean, it was a beautiful day, and we enjoyed it, but I knew my body would say, I told you not to do this. And as Sarah mentioned, having a rare disease, it sucks. I mean, there's no other word for it. And then struggling with your healthcare team, it's awful. It adds more stress. And your disease and struggle, it'll try to isolate you. You'll think you're the only one that has this struggle. But if you look around this room, everybody's nodding their head. They understand you, and we understand you. We being me, and I'll guarantee you the NORD staff and the team that here, we understand you. And there is help and there's hope. So don't think you're the only one that has this, because your mind will tell you, and your rare disease will beat you down. And so I wanted to share that. So my last point is that you have to have other self-care components on your team. And what I mean by that is have some mental health components on your team. If you don't have a therapist, I'd recommend one. I have one because many rare diseases, half the people have depression or anxiety. You also, if you don't have that, maybe every quarter do a wellness exercise online. If you don't have that, you definitely should have a social worker. Ashley's going to talk about that right after me. Join a support group within your rare disease sphere of influence. Have family and friends within your support group. You need to have somebody who you can speak with honestly and get real with when you're raw. So that's the end. All of these components are critical to your overall health and well-being. So I've shared with you 3 tips real quick, and I'll give you just a second to take a quick breath, and I'll hand over things to my other co-presenter from Southwestern Ohio, Ashley Santana.
Hi, my name is Ashley Santana. I am actually born and raised in Cleveland, Ohio, so it's great to be back. I currently reside in Cincinnati, Ohio, where the past 5 years I have been a social work care manager at the Complex Care Center at Cincinnati Children's Hospital. The Complex Care Center is a primary care for individuals with medical complexities, and as part of my role, I work with families to create goals and to help coordinate their care within the hospital and outside in the community with resources and supports. In the past 5 years, there are a lot of things that I've learned that work and have not worked as well in coordinating care, but I wanted to talk about some tips that I think are very important. The first one is how care conferences can help improve communication with other care team members. I participated in a number of care conferences, and they have all been different to address different topics and concerns. We have care conferences for if an individual has a diagnosis and they're wanting to meet with different treatment teams to formulate a treatment plan and just to better understand what this diagnosis will look like short-term and long-term. We've had care conferences during hospitalizations when we need to figure out the next steps and how to create a seamless transition inpatient to outpatient. Hospitalizations are stressful as it is, and I think it's very important to kind of have your team within that hospitalization and your primary care specialists that are very involved all meet together so everyone's on the same page so we can kind of reduce the risk for rehospitalizations and to ensure that there's nothing that's missed in your follow-up care. And we've even had care conferences for if you aren't happy with how your treatment is going, and you're possibly wanting second opinions, you're wanting to have other members who know you just as well participate in that. And this isn't limited to doctors. We've had, therapists that come in. We've even had school advocates that come in that know our patient's children, or the patient. We've had, family, friends who support you guys. So it's always important to include them. I know with COVID that there's been a lot of struggles the past few years, but one of the things that is added is the ability to do these virtually. I think, we've actually been able to improve and include more members with Zoom, Microsoft Teams, or on the phone in these care conferences, just because, one of my challenges is trying to get 6 or plus doctors who have the time to meet all at once. And it's pretty hard. People have different clinic schedules. People are at different locations. So just because you have different doctors at different locations or people who aren't all available in person, I would always ask to see if that's an option. We should be able to accommodate those needs for you guys. Another thing is how my chart and online chart systems can help track care. I am someone who, after an office visit, they give you the after visit summary. I will lose it. I tend to toss it. I tend to forget what was discussed or what the follow-up plan is. And that is for me having just like 1 or 2 doctors. A lot of our patients see 5, 10 plus different doctors and even therapists. So it's always important to kind of have that option so you can always go back. You can actually now view all the notes. Before, it used to be very selective in what you can view in these systems. Now you can read what was written throughout the office visit. You can see what after the follow-up treatment plans are. And not only just for the notes, but it's a way to communicate outside of office visits. You can send messages to your doctor. And I think it helps keep better track of that because then it's in your healthcare chart. Whereas sometimes when you have phone conversations, things can be misconstrued, things can be forgotten, and then you can't remember what was said. So I think it's important to accountability and transparencies on both ends. So, and then with the multiple office visits, it's always good to kind of follow up. You can see where your medications, see who manages them, request refills. So we try to encourage families to connect if they can, just because it's so hard managing so many different follow-ups with providers that you kind of forget or lose track, and we can even message you through them as well if that's convenient. And then the importance of expanding your care team to include community agencies. I think it's so important to build a big network and support outside of these hospital systems. I don't think people realize how many people are actually really in your care team. If you have a child, the school is a big part. Your child is in school for a good majority of the year. So they know your child, they can help advocate for certain things, or maybe even include them for if you're having troubles with their IEPs or the 504 plans, then your doctors can get involved to help advocate for those needs as well. There are groups and agencies specific for disease or disorder systems, so I think it's important. A lot of our parents in our clinic have local Facebook groups. So a lot of our patients, actually, their parents know each other, and that's where they can network, kind of talk to people they can relate to, but also find out different supports, resources for their child that they wouldn't have otherwise been aware of. There are local organizations that can provide connections to services. So an example in Ohio is Developmental Disability Services. We try to get a lot of our patients connected just because down the line there can be supports to help, with independence in their care, waiver support, and as part of my role, I'm a big supporter and advocate to get them those resources. So we do have a lot of meetings with them where they also can be included in care conferences as well. As Jim said, mental health agencies, I think it's very important to have that connection. Managing a rare disease can be hard. It can be at times isolating, and I think it's very important to be able to check in with a mental health professional just to kind of build different coping mechanisms and just to have that support if you otherwise don't have it with close family or friends. And then, as I mentioned, school members involved in your child's care, so that you can make sure that their educational and their medical needs are being met. So those are just some of the tips that I've found along the way, and I will go ahead with Dr. Flannery.
Can you hear me okay? Good, okay. Let's see if I can advance this. Okay, things I've learned along the way. Every patient and family is unique, even if they have the same disorder. So this is an important thing I teach everybody who I work with. I really try to empower parents. I see primarily children, although I do see some adults. And many providers don't listen to patients or parents. And if the doctor you're talking to is not paying attention, you have the right to move on. As Jim mentioned, you could fire the doctor. Another thing, I ran a pediatric residency program for about 10 years, and I always told trainees that mothers are always right. If mother tells you something's wrong, and you can't see it, you're wrong and she's right, and you got to figure out what's going on. We have a team effort in genetics because we have genetic counselors and genetic MDs who work together, and a lot of what we do is help coordinate care for our patients. And then disease support organizations, which have just been tremendously effective thanks to the internet, are a good source of information and help you find providers and centers that have expertise in your rare disorder. So network. You may be able to see experts in other states virtually and not have to travel even after the pandemic ends, so be sure to ask. I see patients now in 5 different states, and so virtual care is really going to be here forever. How I empower parents is also by doing this. I get health supervision guidelines that are specific for many disorders. The American Academy of Pediatrics has examples, which I've shown there, and then support organizations frequently have medical advisory groups that then create guidelines for medical care for that disorder. So whenever I meet a patient and we have guidelines available, I review it with the parents, give them a copy, and I send a copy to the primary care doctor. And I tell the parents to like check that every time before they go to see their PCP and see if there's something they should be doing. If they aren't, ask them about it and point to it. I tried to be brief because I think we were getting a bit longer here, so now it's time for questions. Kind of hard to see in the dark here if people have questions.
So we do have one to kick off, and there are staff roaming. So if you have a question on a note card from your bag, go ahead and hold it up, and we'll pick it up from you. The first one we're going to kick off with is, how can patients connect with specialists who are familiar with their rare disease?
Well, there are many ways. I mean, you can look people up, do research, and then people who specialize in rare diseases and have a specific one that they actually treat, they like doing this, and so reach out to them, send them an email. People get emails all the time, and that can be the start of the whole process. Any other thoughts?
Yeah, so I was going to say, I think the patients that we serve are kind of lucky with the complex care centers because we have a database where we can reach out to other complex care centers throughout the U.S. And so whenever we have families that ask for a specific type of providers, we get to refer to that. But a lot of times when we're asked as the primary care, who can I go to for the specific needs, one of the roles that we do is we kind of, as the care manager, reach out to different specialists that are similar to that to see, have you made referrals? Are there specific hospital systems that you've seen a lot of treatment for this? Recently, we had someone who went to Akron for a clinical trial that we helped connect them with. So I think just kind of, you can start with your primary care, but also with the specific groups and organizations for that specific disease. There could be forums on there where, a lot of parents or individuals can be posting about, where they receive their specific care, what doctors they do and don't recommend. So I think that's also an important place to look.
One other thought is to reach out to foundations or associations that are set up specifically to the rare disease that you're looking for the specialists, such as I have sarcoidosis and Sjogren's disease, and so reach out to like the Sarcoidosis Foundation, and they maintain a list of specialists all throughout the U.S. or internationally, or Sjogren's disease, and they have doctors and specialists across the U.S. So the second is there's always look for support groups for your specific rare disease, and then within those support groups, individual people who belong to those support groups can tell you, hey, who's the best doctor to see in Chicago for this specific disease, or whatever area you're in, and those people always know the best doctors to go to and always the best ones not to go to, and honestly those are usually the best sources that I've found.
Okay, next question. What do I do if genetic testing is denied?
All too often, yes. And don't get me started talking about peer-to-peer, because I'm a geneticist. I talk to people who don't even know what genetics is, and they're the peer who makes a judgment. We become creative oftentimes, and sometimes we can find sponsored genetic testing, which means that a pharmaceutical company is underwriting the cost of the testing. We explain to people that if we do that, the pharmaceutical company probably is looking for patients, and they probably ended up contacting me if they have something, and then it's up to me to talk to the patient. But I make sure people understand that in advance, because there are now quite a few sponsored genetic testing programs out there. Another thing we found is that some labs, and depending on the test, we know which lab we would use, will sometimes work out a deal where they say, well, your maximum out of pocket if we just bypass your insurance is $250. You know, the list price is $1,200. So in reality, there are often times where we can actually find a way to get that done. And then another thing that you can consider is the rare disease diagnosis network, what's it called? UDN, Undiagnosed Disease Network. There are now clinics around the country sponsored through the NIH that specialize in undiagnosed disease patients, and they do thorough evaluations. You have to apply to them and submit your records, but that's another alternative source.
Okay, this one is part specific and part more general. The first is, I have issues getting my specialist to communicate with my genetics team. What should I do? And there's another question that's similar. What is the best way to get your healthcare providers to communicate when they are at different hospitals in different states, and especially if they don't necessarily agree on the diagnosis and or treatment?
So coordinating care between different hospital systems can be difficult. I think a lot of times with you know, the MyChart or the Epic type systems, there is the share everywhere option where you can send medical records, but it does require a lot of work and coordination, which can be a lot for you, especially if you're trying to manage your care and have a lot of stressors involving your diagnosis. But I think starting maybe with the primary care, or the primary specialist that is managing or following your following you, and reaching out to them and seeing if they can help make that connection. If a doctor ever says, no, it's not my job to reach out to other doctors, that's not true. It's part of coordinating your care. I think we need to kind of, you know, realize that it's important to, you know, talk with other doctors, you know, get on the same page. So just even starting with that provider that you're most comfortable, that knows you the best, and saying, okay, this is where my other specialists are. Is there a way we can communicate? Is it through your guys' Epic system, through email? What is the best way to start that? And then go from there. And then even try to create like a care conference if you guys can set up like a Zoom, Microsoft Teams meeting if you're all at different locations, just to start having those conversations. I think that would be a good opportunity.
Yeah, that probably is a situation where you should fire the doctor and get another one.
I have a couple of thoughts on this. One is, remember I said tip number one, rule number one is you have to be a patient advocate. So one thing you can try is offering to have a Zoom call and asking each doctor to participate. The second is kind of like that, but one of my roles with the Foundation for Sarcoidosis Research is as a patient navigator, and I walk alongside newly diagnosed patients for a period of time to help them become their own advocate, and as they learn about the disease. And one of the things I've done is establish Zoom calls with some of their healthcare providers, similar to the role that Ashley does. But I would recommend that they have a social worker on their team to do exactly what Ashley recommended in her talk. And one of her tips is to get their healthcare providers together and have a call and review the status of care and come to a decision. Now, many doctors may or may not like to do that, so you have to resort to the doctor's recommendation and maybe find another. But I haven't found a time when we haven't been able to come to an agreement.
Along similar lines, do you have any recommendations for patients who move from one place to another and must start again, maybe, depending on their ability to travel to get to their providers?
So with the primary care, we do help with a lot of transitions. We only manage our patients from birth to young adulthood. So we do a lot of transition to adult care, and sometimes that involves a different hospital system within or out of state, or we get a lot of people who move to get to the Cincinnati Children's for a specific need. And we try to create what's called like portable medical summaries. So having a list of diagnoses, list of medications. As our primary care, we create what's called like a 5-sentence summary to kind of do a brief summary of the history, the main specialists that they involve with their care, any recent surgeries, just kind of gathering that and having that available. Make sure you're signing releases of information so that medical records could be sent easily to different hospital systems. And we always try to do a handoff. So I would try to see if your main provider can do a handoff to the new specialist to where you're moving, whether that be email, over the phone, or even just having a meeting, just so there's no gaps in that transition.
I also recommend keep good notes for yourself at all time. Download your medical records periodically. I usually do mine the first of every year, and then also keep notes of when you have regular radiological exams, and download the readings of those, just to keep those for this exact purpose. And then ask your primary specialist for referrals in the new area you're going to, because doctors go to periodic conferences themselves, and they know people, they meet people, they've gone through, I don't know, doctor, dozens of years of school, and they know classmates, and they keep in touch, and they know people. So again, the asking for referrals and recommendations is key.
How can patients find a good mental health provider to help with complex medical conditions?
It can be challenging. In our area, we have what's called like trauma-informed care, and a lot of what that involves is what people don't realize is medical trauma is something that happens. A lot of our patients do have like PTSD from like experiences with their medical care. So like in Cincinnati, we are trying to have that with different mental health agencies so that they can be more informed in that type of care. Not every area has that, and especially in rural areas, that can be a challenge. But I think more and more mental health professionals are offering virtual. So don't think you're just limited specifically to your town. See if other agencies that might have more experience working with disease systems, medical complexities, but a lot of times there can be limitations to that too with insurance coverage. So you can always ask your medical professionals, your primary care physician, to see is there referrals to places that you've had a lot of success with. And again, going on to those disease system forums and asking other individuals and parents if they have recommendations for therapists in your specific area, or if not in your area, can they offer virtual sessions?
Okay, we have a couple of questions about prescription coverage. My insurance denied coverage of my prescription. Do you have tips for instances when insurance is denied? We also have a question about how to navigate the insurance world when you've been prescribed something off-label, or for a reason that the drug was not initially intended.
Now, I'll take that, because for my primary disease, sarcoidosis, for 30 years, there's only been one FDA-approved drug, and that's steroids. And steroids created this body. I used to be 6'1" and 180 pounds, and I'm not that anymore. My wife married me at that. You can see the look on her face now. So every treatment that we're given, insurance denies it right away. So the key is, I think the doctor mentioned, you have to have a peer-to-peer review. So your doctor has to have a call with the medical director of the insurance company, and once they explain it, it's usually approved after that. Many times you have to do it again. The last time that I had to have a chemo drug approved and an infusion therapy, the first time that they called, the doctor said, sarcoid what? they had never heard of it, so they had to call back and get another professional who Googled it and then said, well, okay, we'll approve it this time. So the answer to both of those questions is the same. You can appeal it without your doctor calling in, but you have a higher chance of approval with your doctor calling in. That's for off-label. Now, I've used that for $5,000 to $10,000 per treatment drugs, so that's every 2 weeks for me. I think it's higher for genetic or other treatments, but that's what works for me.
Yeah, I definitely recommend having the doctor who prescribed the medication to do a prior authorization. And like Jim said, if those tend to be denied, there are some instances where the doctor can do a peer-to-peer with the insurance company to help justify the reason. In some cases, they might ask you to trial alternative medications to have those fail before you get to the medication. But, sometimes those doctors are aware of those and they can kind of write letters of medical necessity around, they can't do this option because of these symptoms. This is why they need this medication. And then in some cases, insurances will have you do the generic of that type. But I would just definitely talk with the doctor who's prescribing that medication. Some instances, there can be some grants or type of foundations that might be able to cover that cost, so always explore those. But if they do recommend an alternative and you are really wanting that specific type of treatment. But yes, just connect with your doctor. It's way easier to do it than you appealing on your own because, it might not be the first time that they've had to do it, and they might already know what the steps they need to take to get that approved.
And by the way, I mentioned here's the plus side when you bring candies, chocolates, cookies to the office. Doctors on their own just won't pick up the phone and call the insurance company. So you got to call in and ask the office assistant, office manager, or medical assistant, put on the doctor's calendar for 4:30, right when they're nearing the end of seeing patients, to book an appointment to call the insurance company, because otherwise the doctor will just work right through the schedule and come to the end of the day and not have time to do it. So that's how you kind of get things done.
Yes, the admins in our office run our doctor's schedules. So that's definitely very true. You can always send like a message, electronic message to set something up, but typically either myself, the care managers, or the admins are the ones that typically coordinate that with the insurance company. But it's always good to include the doctor in that as a heads up too.
It's especially effective. Many insurance companies now, what they do is they call the doctor. So they set up the appointment and they call the doctor, and it's going to be hard for he or she to ignore that when they call. So that's a plus thing. I would think some people in the audience may have some ideas about some of these questions we're having too. If anybody has some suggestions they want to volunteer from the audience.
We're actually running out of time.
Sorry.
But I think some folks may corner you as you exit stage. So I want to thank our speakers and thank you for your time with questions from the audience today. Let's give them a round of applause.